Hello and welcome to the Peak Endurance podcast. And once again, I am welcoming Luke Nelson onto the podcast. Hello.
Thanks, Isabel. Yes, yeah, great to be on again. Again, we're ticking off through these injuries. We've got another tendinopathy today. We've spoken about Achilles tendinopathy in the past, and now today we've got we're going a bit higher up into the buttock there, and talking about. So we're going to talk about all things hamstring tendinopathy.
And it is quite a common one for runners, and I certainly hear often about it through friends and so on, that people are struggling with hamstrings, and it tends to hang around for a while. So I think it's a good one for us to go over and try to help people with.
Yeah, it is. Look, it is a particular nasty one. It's probably out of all the tendinopathies, if you'd ask me which one I would rather not get, I'd say it'd probably be this one. Probably because it just tends to interfere with life a lot. You know, we mainly because around the discomfort that it can get when sitting. And that's where if we look at, some of in fact, last year during lockdown, I saw when we had our most restrictive lockdowns here in Victoria and Melbourne, I saw so much hamstring tendinopathy. It was like a plague of it. It was a lot of that was actually centered around the amount of sitting time that people were doing, because I saw this was popping up in not just runners, but also non-active people, and because they've been sitting for so much more than what they used to. So it's really can be a frustrating one to deal with for runners, but also non-runners alike, and even in gym goers as well too. And if we look at some of the common symptoms that people will describe with this, it's a pain that's really quite high up into the thigh there. It's almost at the crease of the buttock. So people will point usually with the fingers and say, it just hurts right up around that area through there. It doesn't tend to refer so much down the leg, but it can. The reason being is that you've got the hamstring tendon that attaches right up in the buttock, but then right next to it, you've got the sciatic nerve. And when that tendon is annoyed, it can also annoy the nerve that lays adjacent to it. And that can start to sort of refer some pain down the legs. But by and all, most of the time, it tends to be more confined around that buttock area. Things that tend to aggravate it and annoy it are sitting. For the runners, it's hill running. So we were running uphill, and that's sort of putting a bit more tension and compression on that hamstring tendon there. It's faster running as well. So as we run at faster speeds, we're striding out further in front there, and we're sort of getting greater knee towards chest movement, and what we call hip flexion. And that again sort of puts that hamstring tendon under more compression. And then we've got, again, in the gym, so moving away from out in the running track, we've got things like squats and deadlifts that can create, again, that compression. And that's where we think that, and it's still a condition that hasn't had a lot of research into it, but we think that the current line of thinking is that it is the compression of the hamstring as it attaches right up into the buttock bone, into the sit bone. And what makes that hard for runners is because we often don't have a lot of padding around our buttocks. So, being often more a slender build. And unfortunately then we're sort of more prone to that compression and the agitation, because we don't have any overlying fat or a lot of muscle to protect us as we sit down. And with the sitting, it is often worse on sitting on, harder chairs. So like sitting on a plastic chair or it's something that just doesn't have any cushioning on there will tend to make it a lot sorer.
Can I ask, why uphill running? To me, not being an expert in the field, obviously, I would have thought downhill running would perhaps be more aggravating to it. So
no, it's good.
Uphill running?
Yeah, it's a good question. And the uphill is, again, due to the amount of that hip flexion that you're getting. So as you're going uphill, you tend to bring your knees, drive the knees further up towards the chest there to sort of clear the ground. And with that then comes more of that compression of the hamstring there. So yeah, it tends to be more the uphill. The other thing that which some runners do, which is not ideal, is that when they run uphill, they tend to sort of really lean too far forward forwards. And we'll sort of see later on, but as you do lean forward, it does sort of increase sort of the tension and the compression on that hamstring. So it's sort of a combination of both, of a bit of that, too much of that forward lean, and then with the knee coming up. Whereas when you're running downhill, you do tend to be more upright and sometimes even leaning backwards a little bit. And then with your strides, you're not bringing the knee up towards the chest so much. There can still be overstriding. So you are right there. And some people with this condition also find downhill running quite sore on it as well. It's just that, and so usually when we're managing these, we're getting people to try and stay away from hills, because if what goes up must come down, and vice versa. So we do tend to get people running on a flatter ground with these. So whilst we're cutting out the uphill, we're usually cutting out the downhill as well. But yeah, it usually is due to bringing those the knee up to the chest. The other thing that tends to aggravate these as well can be stretching, and so we can see this in people that have done something that does involve a lot of stretching. So, for instance, if a runner has decided to take up yoga, they've added yoga into the mix, or Pilates, where they've got to bring the the leg straight up, and or they've decided that I need to improve my flexibility. I'm going to do a lot of toe touch stretching, those sort of things, which put a lot of sort of pull and potential compression on that hamstring tendon there, can aggravate it. And so these are some of the things that we do tend to find, with the increase in stretching, the increase in sitting time, especially on a harder chair, the running, obviously, and then in the weights, things like with the deadlift. So as good example through here, you can see how that's in that position, the bottom of a deadlift there puts a lot of that pull on through that hamstring tendon, and certain medications as well. And there's other things in terms of hormonal influences as well, which can make people more prone to developing this hamstring tendinopathy. So a few things there that we see. And then, like we've previously discussed with all our other running injuries, is, there's lots of things that will go into a running injury, lots of things that will contribute to it. So, looking at what your stress is like. So, your workload, your training, how that's been managed, your recovery, what that's like. Obviously, poorer recovery can increase the stress on your body. Stress in everyday life, obviously with lockdown happening at the moment, and like it has in the last year and a half, that can be quite a stressful time for people. So that can actually contribute to these things forming. And then on the other side, things that might protect us from an injury are things like our strength and how we move, our biomechanics, our running gait, and those sort of things too. So lots of things that can contribute into it. And this is always something that when we get someone with a hamstring tendinopathy in front of us, we've got to figure out, well, why in this person, why has this happened, and how do we then formulate a plan to work around it? Because you can have two people with exactly the same diagnosis, but there's different contributions for both, and so the difference in management as well. And if we have
noticed some people, you were saying about previous injury, that some people have a tendency for it to be a recurring injury. Do you find that happens a bit too?
We do. I mean, it's like that for a lot of injuries, that if you have had an injury once before, you are more prone to it, and that's especially so with the tendinopathy. So with your Achilles tendinopathy and your plantar fasciopathy or plantar fasciitis and your hamstring tendons, they do have a tendency to recur, and they're sort of, we never like to sort of say the word, but almost an injury for life, in that it's something that you sort of have to, you do have to manage it. That if you don't do things right, like say for instance, you were to do all of a sudden to suddenly increase your training load at a certain point in your life, then that's something that may rear its head. It's not saying, when we say an injury for life, it's not something that, you're going to have pain in this area for the rest of your life. It's more like, if you don't do things right, then that's what's likely to recur for you. So yeah, this is an injury. Is one of those injuries that can persist for quite a long time. It's usually months and months that you're looking to get this under control, and then it can recur at a latter stage. Fortunately with this, and we'll talk a bit more about that with the running, but it is often an injury that you, most of the time, that you can run through. You can continue to train with it as you're getting on top of it. So whilst the pain might persist for months, you are able to run and do things in that time, and often get to, your full performance and being able to do everything, but just with this niggling pain that's in the background there. So yeah, it is something that can recur. If we have a look from our point of view when we're dealing with someone with buttock pain, there are a number of things that it can be. So we firstly want to actually get an accurate diagnosis and make sure that that's what it is. There's a number of things around that area, such as issues at the hip joint, and then we've got nerve issues as well. So where there's potential back problems or some nerve entrapment issues that might be occurring in through the buttock there. Some of those things that can replicate or make it look like a hamstring tendinopathy. And sometimes people might have multiple things happening at the same time. So people are more than within their rights to have more than one problem. So that's always something we try and tease out and make sure that it actually is a hamstring tendon that we're dealing with. And usually the ways that we figure that out is you can often pick it from the symptoms. So if someone's had, a particular aggravating activity, they're really sore specifically on the spot, what they point to, and then there's a few sort of tests that we use to look at, typically like doing a hamstring stretch. They can feel it right at that particular point. Then it's they're usually pretty easy to pick up with that it is a hamstring tendon problem. So if we now sort of talk about some of the things that can be done for it. So we've obviously got our diagnosis and figured out that, yep, it's hamstring tendinopathy. We have a look at some of the things that we want to, how we want to rehabilitate it. So hamstrings are obviously a big part of it. And that's often what we find when we're doing, we do a lot of strength testing in our clinic. And when we're dealing with these, we often see a lack of strength in the hamstrings. Now, whether that's happened before the onset of the tendinopathy or whether that's happened as a result of the tendinopathy, we don't know. Obviously, we can only see what's happened on the right there on the spot. I reckon it's probably a bit of both. I think a bit of both can contribute to it. So you may have had some pre-existing weakness there before, and then it then got worse as you develop the tendon changes. But yeah, a big part of the rehab is actually getting that, working on that hamstring strength and getting that up. And also whilst you're doing that, whilst you're stressing those hamstrings, you are also stressing the tendon as well. And we know with tendons, they like load. They don't like to be overloaded, but they don't like to be underloaded. So we've got to sort of make sure we hit that sweet spot there. So a lot of the exercises we're going to choose are going to be based around the hamstrings. So earlier on in the piece, when things are really irritable, so if they're really cranky and, people can't do much for them, they can barely sit down, we like to use a particular type of exercise called an isometric exercise. And that's where we've spoken about that in our previous talks. But basically is an exercise where there's just no movement, no change in you're basically pushing into something there. So, and the muscle's not lengthening, the muscle's not shortening. And so an example of some of those might be, you can see in this image here with someone doing a hamstring curl, they might be lying down in the machine and you can actually, lock the machine in place and you're basically just pushing hard into that. With all these isometrics, we try and get people pushing about 70 to 80%. So you're not going full 100% as hard as you can pushing into the resistance, but it's about sort of 70, 80%, and they're long sustained holds. So you're looking at between 30 and 45 seconds for the hold, and then, repeating that anywhere from sort of 3 to 5 repetitions. The good thing about with doing these isometrics is, and especially for the ones that are really quite cranky, is that it'll actually often feel better, and most of the time it should feel better after you've done them. So if you've got a particular, you're walking around in the pains, you say you do a squat and you're like, well, that's a 6 out of 10 pain. You do some isometrics and you'll often see a drop in, down to sometimes a 2 or 3 or below that pain. So they can be really good to help.
Why that is?
Yeah, it's a sort of a complicated mechanism. We don't know exactly why that's the case. So that's the honest answer. The why that it might be, that potentially with the contraction in through there. I mean, in its simplest sense, is making that tendon happy, or it's almost desensitizing it temporarily. So that's where it may play a role. But we find that's what we call analgesia. So that the window of feeling quite good, that can actually last for some people, can last for a few hours after they've done some of these isometrics. And so these isometrics can be done.
So is it something you could do before you run?
Yeah, absolutely. So, and that's something we'll often recommend for these is that we can try them at different points of the day. So, you know, if and you can do them multiple times a day. So if someone's like, yeah, I feel good for a few hours after I've done them, but then it starts to come back, we'll then do it again. You know, and they won't exhaust you, and so that's where you can do them before a run to warm you up, because they won't leave you with, you know, jelly legs like other sort of exercises can. In fact, some people can actually feel pretty good. They feel like, oh yeah, I've got things ramping up and going there. And like is often the case with these tendinopathies, they will often feel a bit stiff and sore for the first few Ks. So they take a little bit to warm up. And so this can doing these isometrics can help, you know, shortcut that warming up process, in that the first couple of Ks for them now actually feel quite good, when previously before they've been hobbling around and limping and feeling like they're doing the Cliff Young shuffle just to get going. So yeah, it's a good question, and yes, they can be done before a run. Some of the other types of exercise they can do are what's called a supine isometric, where you're basically just laying on your back and you're pushing your heel into the ground. So that's another variation there. You can also do that whilst you're standing as well. So you can stand and drive the heel into. So if you think about you standing on top of a gutter, you can bend the other knee down a little bit and then push back into the gutter there. So you're getting that hamstring going, getting that, anything that basically gets a contraction in the hamstring is going to be working well for this. You can do like a bridge where you're bridging in between, you know, a couple of different, a couple of tables, a glute ham raise, which is a bit more complex. You need a bit of gym equipment through here, but we can see on this, the image here where we're doing a glute ham raise on a glute ham raise machine, but you're just simply holding it into position. And then we've got Nordic isometrics. So Nordic curls are where you're kneeling on the ground, you've got someone holding your feet, and then you basically lower down to the ground there. With a Nordic isometric, you basically just, you know, you have someone holding you, but you just hold the position. So you're just holding that hamstring contraction there. So as we mentioned, you know, 30 to 45 seconds with these, and reps, you know, anywhere between 3 and 5 reps of those. You can have a bit of a rest for 30 or 60 seconds between each one, but they can work well. Some people don't need these. Some people find that they actually can make them worse. So if it makes you more sore, I probably won't use those. If it's not too irritable, not too angry, then and you know, people have got minimal pain when they're running. Again, I often won't worry about going on with these. I'll often move them onto the next set, or the next type of exercises, which is you know, strengthening, working at getting that strength back in through that hamstring and the tendon. And some of those might be doing a hamstring curl. So that's, you know, laying on your tummy, and you can use either doing it in the machine. So before the isometrics is more just holding it in position. With a curl, you're obviously getting it, just moving it back and forth. Always go for single leg as well. So single leg to make sure that you're working that one leg at a time. Make sure the other one isn't compensating for that. You can use a band for that as well too. So using the band, tie that to your ankle and just bring that back and forth. Then we've got a full Nordic. So, you know, before we had the hold. So this is just going down into a full Nordic position. And why we tend to use these earlier ones is because they don't involve much hip bend. Because remember how we mentioned before that in the sitting position where your knee's coming up towards your chest, that tends to aggravate the hamstring tendon. So for these early strengthening and for the more irritable ones, we try and keep the hip as straight as possible with a lot of these exercises. So we don't have a lot of hip flexion. We've got a prone Superman, which is basically laying on your tummy and, you know, lifting your legs up off the ground, lifting your arms up at the same time. A standing banded extension. So, you know, standing up and kicking behind you. We've got a small bridge, so where the hip's not bent up too much at 30 degrees. Hip thruster is another good one where you're not getting too much of that hip flexion. And then a sliding bridge is also a good one to do. And then you can if tolerated, do like a step up, but on a smaller step, or even just onto some plate weights where you're just stepping up there. It's really good for that exercise. Is great to get some glute max engagement going on there, because that's one of the things we often find can also be impaired is you lose that glute max and the ability to extend the hip behind you. But we often, I mean, one of the things is we're never just looking at the area that hurts, but also looking at some of the other areas around it, because we do often find with those with hamstring tendinopathy, they may have loss of strength around the other hip muscles. They may also have loss of strength in the calf on that side, and even in the quad as well. So that's where it's important to assess through all those, because you don't just need to work on the hamstring tendon there, but you may need to work on some other things at the same time to make sure that this doesn't become a recurrent problem. So there's some of the earlier stuff that's not too irritable for the tendon, and you can load those up, load them up quite heavy as well too. So then we go on to some progressions for strength here. So this is where we start to get a little bit more of that hip flexion going. So the knee coming up towards the chest. So we've got like a 90-degree bridge where we're raising the feet up on top of a chair or a bench there and doing a bridge there. We've got a single leg deadlift, or those arabesques or drinking birds. And starting off, you can start off with quite shallow there, and obviously as you get able to tolerate, then going further and further down. Roman chair extension, which is sort of similar to the glute ham raise machine, that you're sort of bending your trunk forward and then raising back up. So really putting those hamstrings under tension there. We've got a deadlift, so we can start off doing a bit shallow to begin with, and then progressing that. Then a lunge as well, working the different depths, and then we've got our progressions of a step up where we were initially on a low step, but we can progress up onto a higher step there as well. And then going on from that, so we've had our easier stuff. We're starting to challenge the hamstring a little bit more, and this is where we can go on to some more of the ballistic movements, so some more rapid and plyometric stuff, which is really quite challenging on that hamstring tendon. So we can do what's called a hamstring tantrum, which is basically do that on a Swiss ball or a band, where you basically, imagine a kid or a toddler on the floor, banging their legs against the Swiss ball or band there. Yeah, it's a good one. So that can be a really good one to create that rapid contraction in the tendon there. Then we've got kettlebell swings as well, nice and explosive through there, really getting that fast movement. We've got some counter movement jumps where we're sort of squatting down and then exploding up into the air as quickly as we can. Step jumps, so jumping up onto box jumps or step jumps there. Broad jumping, where broad jump is where you're on 2 feet and you're trying to jump as far forwards cover as much distance as you can. Bounding is when you're doing that on one leg and you sort of go from one leg to the other. They're sort of quite an advanced movement, so certainly not for the beginners, those ones. And jumping lunges, again, certainly not for the beginner. If you look at the air time that this guy's getting in this image here, it's quite a big load, especially when you're really landing down into that hip flexion there. That in fact, I've seen patients that have done this particular exercise and have actually triggered their hamstring tendinopathy. So, but in the right dose, it can be very good for it to challenge and strengthen it. So there's sort of some of the strengthening exercises and sort of the progressions that we'll use to strengthen the hamstring and the tendon. So you can see there's quite a lot of selections that you can go with there, and I wouldn't do all of those. I'd pick a couple out of those and mix it with some other things that you need to work on at the same time, but then gradually working up to more of these ballistic movements as it can tolerate. So we spoke about before, we bring up the image before of some of the things that tend to trigger it, and so these are some of the things that you tend to modify. So you don't often have to cut things out completely and saying you need to stop sitting, but you may need to reduce your time sitting. So for work, I always tend to encourage people that every hour I should be getting up or 45 minutes getting up and having a bit of a move around anyway. Time away from the screen refreshes the mind and gets the body moving a little bit. So especially for those with hamstring tendinopathy.
Can I ask a question? Some people, when they have this hamstring tendinopathy, like to get a ball and stick it under their butt and sit on that. What's your opinion on that one?
Glad you asked, actually, and that's something I don't tend to advise doing, because again, we tend to find that poking at tendons just tends to make them a bit sore. So you can use for that self massage. You can work around the site, but not directly over it. So you can work through the rest of the hamstring. So you can use, massage gun or foam roller or the massage ball through the rest of the thigh. And you can also work in through the rest of the buttock with those sort of things. But in terms of where that hamstring tendon attaches up into the sit bone, I'll tend to get people to avoid that. So don't do that on the buttock there, because it can annoy it. And that's a couple of things. Look, some of the two things I find that people do often get wrong with these is that one, they're either, vigorously massaging it themselves and it's not getting any better. In fact, it can be getting worse. Or two is the other thing is they've been stretching it. And that's where, again, we sort of want to move away from stretching it too much. And so when it comes to doing things like yoga positions or, Pilates or gym-based movements, we'll try and modify those activities. So you're not going, as deep into the movement there to save that compression on the tendon. But stretching is never really a big part of getting this well. We sort of want to try and limit that as much as we can. So that's what we've got our triggers. The two biggest things we want to try and modify are the sitting time, making sure that also that you're sitting on a cushioned chair, so not sitting on harder chairs there. So that might be putting some extra cushioning down on your work chair. It might be getting a stand desk, a sit stand desk. The worst ones of these that I've seen are people where they can't even sit for more than 5 minutes without it hurting, and they're really nasty ones. So for them, they've got no choice but to do a stand desk, and obviously that settles down, then they're able to sit a bit more. But yeah, when these get really annoyed, they're not nice to sit with. And that's one of the challenges I mentioned before. Why I would not like to have this myself is because it affects sitting, and we sit for so much of our lives. That be for most people for work. That's commuting in the car. We sit for entertainment at home, and so there's lots of ways that this can impact not just your activities with your running, but also affect your life. And that's where it can get really quite challenging and sometimes even a bit depressing for patients with this condition as well, because it just impacts into so many things. So that's why it's a particular nasty one. And here we see an example of something that, a lot of runners will do to manage this, the old, leg up on a bench and bend down to touch the toes. And it might have a feeling that it needs to be stretched, but but the stretching will not do it any good. We talk about, some of the other ways that we want to manage this. And we always talk about running loads and making sure that we get that right, making sure we don't get those peaks and troughs where you're doing too much one week and then doing nothing the next week. So we want to try and, find a level that's suitable for you where you can manage that tendon. It's okay to have some discomfort there around that 4 or 5 out of 10 in the tendon there. And so long as it's not going above that, we can continue to progress the running. And that's where having a good coach is invaluable here to make sure that they keep you on track and keep that keep those running loads consistent and gradually building up, and whether you need to have a bit of a rest, then programming that in there as well too. So really important with the running loads. If we spoke about, we touched on with that 4 to 5 out of 10 is safe to have. So that's, we don't want to see it escalating above that during a run, after a run, or the day after a run. So if you're waking up the next day and you're like, geez, my hamstrings, 6 or 7 out of 10, then you've probably done a bit too much. And then what we want to see is that you can actually, so for the next run, say if you've done 10 Ks, well, what you can do is maybe the next time scale that down. You might reduce that by 10%, might even reduce that down a little bit more. Try that. How does it respond there? Oh, that's actually better. And so then you can stick with that and use that to work on and gradually build that up to then going above that previously sore point, and then continuing to work that and beyond. So we don't need pain-free like managing most other running injuries and these tendinopathies. It's okay to have a bit of pain. They will often warm up as in those first few Ks, so that's acceptable there. But so long as they don't come back with a vengeance afterwards, and people rolling around after the run, it just being so sore, so that means that they've overstepped the mark. We mentioned about the hills as well too. So just trying to limit for those with hamstring tendinopathy, keeping it on the flatter ground for the time being until we see the tendons get under control. And also we don't tend to introduce speed work too much. So just sort of keeping it nice, easy runs on the flat tend to be a bit better tolerated. And then as it starts to settle, then you can start to put some of the faster speed work and intervals, and then gradually hills as well into the mix. Running technique. So we spoke about, you touched on before with that, with the why, running downhill might be an issue. And the other reason also with downhill is that there is often a bit of overstride there. And so some of the things that we can see on this image here, the two things, imagine that the hamstring's running up the back of the thigh here and it's attaching up into the buttock. So with overstride, as we sort of bring the leg further out in front of us, it's going to be putting a bit of an increased tension in through that hamstring, and then also potentially with a bit of compression there. Now, if we combine that with bending forward, and you can try this yourself, you can stand up with your legs sort of out in front of you, resting on your heel, and then bending forward at your hips, and you'll actually feel that tension through the hamstring. So we want to try and reduce that overstride. So keeping your strides a little bit shorter can reduce the pull on that hamstring and that tendon. We also want to make sure that the pelvis isn't tilting forward. So some people, when they run, their pelvis can really tilt forward and have a bit of an increased arch in their back. And again, as you do that, if you stand with your leg out in front of you on your heel and you increase that tilt, you'll actually feel that tension in through the hamstring there. So we want to make sure that there's none of that happening. And then we also want to sort of run a little bit more upright. So we don't want to be leaning too far forward. And look, some people with the hamstring tendinopathy, sometimes we see some of these faults, and so we work on these. Other times we don't see it at all. We look at their technique and think, well, that's actually pretty good. There's nothing that we need to work on there. So don't think that just because you've got hamstring tendinopathy means that you've got any of these running technique issues. It doesn't mean that at all. It's something we assess. If you've got a little bit of an overstride, then we can reduce that. So there's some of the things that we want to look for running technique wise. And so, just to conclude and wrap it up, some of the things that we look for with the hamstring tendinopathy. So firstly, we want to make sure that we've got our diagnosis. Is it actually the hamstring tendon, or is it one of those things around it? Also getting a really thorough assessment to make sure that, what's your strength like in that area? What's the strength like in the rest of that leg? Also looking at some of those other factors we spoke about before, about what could be contributing to your particular issue. Have you just done a whole lot of sitting or have you just suddenly increased your hill work? Is there a lot of stress happening? Your sleep hasn't been great recently. So looking at all these things and figuring out why for you this has happened. Then we want to progressively strengthen, so especially some hamstring targeted exercises. So isometrics for those that are really angry, and then those progressions for the exercises, with gradually adding more of that hip flexion there as it can tolerate it, and then working on to some more ballistic and those plyometric exercises. We want to try and limit those aggravating activities, so things like sitting for long periods of time, sitting on hard chairs, and also try and stay away from the stretching on that, and also the self-massage directly on that area, as you pointed out before, Isabel. And then also consider, is there running gaits, running technique changes that need to be made that may potentially help, and also looking at your running loads as well, and making sure that you're not, that you can keep a consistent amount. It's okay to run with a bit of discomfort there, but not pushing through into too much pain, and not, running three times one week and then nothing the next, and just this up and down seesawing. So there's a few of the sort of the key points that we have for those with hamstring tendinopathy.
Now, I just thought I'd sort of, focus on a couple of those points. Now, when you talk about progressively strengthen, and I think we need to really highlight the fact that it's important to continue that strengthening work after it's resolved, because otherwise it does become a recurring injury. Am I correct?
Absolutely, yeah, you're right there. And I think that a lot of runners, when this is across the board really with any sort of injury, it's something that will often benefit you to continue to work on that. And that might be whilst you're recovering from the hamstring tendinopathy, you might have a number of hamstring focused exercises, but post you might only you may have just one or two, or you may cycle them. And this is again where it comes to a good good strength coach that can sort of work out how much is enough, and it's something that building strength takes months and months to get that up, and so the pain with these can often disappear very soon, but that doesn't mean that you've got your strength levels up to where they need to be. And if there's that sort of continual deficit, well, as you so rightly pointed out, out, then it can a lot easier return. So yeah, it is something that I always do try and encourage people to keep something up after they've recovered, and even if they have regained full strength, it's good something to keep going to maintain that good level and make sure that that doesn't drop down again and the tendon becomes cranky. Good point.
Yeah, I mean, I've noticed that with people, and myself included, that, once you start to feel better, you kind of think, well, I'm golden now, and you forget all about it. But it really is important to keep focusing on developing your strength.
Exactly right. Yeah.
Another point I wanted to make is when you were saying about consider running technique changes, that how important it is to have that checked by someone like yourself, rather than just going out and going, well, I've got this, I'm just going to go and change my technique, because technique changes is one of those things that really only works if you're doing it 100% correctly.
That's right. And like I said, just because, you've got this condition, you've got hamstring tendinopathy, doesn't mean that you've got these, these running technique issues. So yeah, you don't want to be changing something if, there's the old saying goes, if it ain't broke, don't fix it. So obviously as part of a thorough assessment, making sure that, well, what is exactly wrong with you, and then what needs to change, and formulating that plan from there, and how you implement those changes as well too. So yeah, very good point.
Yep. All right. Well, thank you very much for sharing once again your knowledge with us. I'll have to go back and check and see how many times we've been on.
I don't know. Lost count. I don't know whether we're 5 or 6 now. I actually can't recall myself, but it's always a pleasure. I love. You can probably tell. I love speaking about what I do. I love seeing runners and helping them get back out there, and keeping them out there. So we'll keep going. Unfortunately, as we pointed out before, there's lots of things that can go wrong in runners, so lots of different injuries, and so we'll keep working our way through the list.
That's right. And certainly if any listeners have any particular injuries they would like to have us focus on, do comment and let us know, because then we'll get to it quicker. I'm sure we'll get to it eventually, but that way we can get to it quicker.
Excellent.
All right. Well, thank you, Luke. Appreciate your time.
Thanks, Isabel. Thanks for having me on again.
See you later.